Hey guys, it's Nurse Gwenny. Let me tell you why I love the nurse-medic combination on HEMS or helicopter EMS teams. It's the most common team configuration here in the United States. There's a couple of programs that across the nation that might fly medic physician or nurse physician, but by and large, the vast majority of US HEMS teams fly nurse medic. The reason I love that is because both of us come with our own strengths. We both each also come with our weaknesses, and we tend to cover each other and work really well together. When paramedics go through medic school, they learn algorithmically, if this then that. This leads to quick decision making. This leads to a fast identification of life threats and intervening to stop those life threats. But they tend to be weak on thinking about sequelae or consequences of their interventions that they perform. Whereas nurses, we are taught with something, brace yourself, I'm about to trigger us all into PTSD, called nursing care plans. What? We all did them in nursing school. We all complained about it and said, this is pointless, I'm not learning anything. But now that I teach critical care education, I absolutely see how nursing care plans in nursing school helped us to learn to think holistically about our patients. You remember doing those? Remember, we looked at the patient's history, their home medications, their trends of their labs, their current vital signs, their assessment. We put all of these pieces of information together and we tried to find the bigger picture. Now, we don't make decisions nearly as fast as nurses, do we? Well, maybe once you come to the pre-hospital side, you get a little bit better at that. But we are used to looking at our patient, making decisions, figuring out what needs to be done with an interdisciplinary team, and then we got to go ask a doctor permission for it. So when you come to pre-hospital flight medicine, and we've got a medic who thinks fast and thinks algorithmically, and a nurse who might recognize something and say, we need to investigate that further and gather more information. When we start thinking like each other and learn to function like each other, we tend to cover those weaknesses of nurses being slow, paramedics maybe being a little bit sloppy or not thinking about the long-term impacts of what they do pre-hospital, and we form a really great team where we learn to nurses think faster, paramedics think more holistically, and we provide great care for our patients. I have learned so much from the medic partners that I have flown with over the last 6 years. I'm so thankful for their influence on who I am as a nurse, and I look forward to plenty more years of learning from my medic partners. So shout out to all of you flight paramedics out there. Keep teaching your nurses, especially how to read EKGs. We couldn't do it without you all.